As the weather warms up in many parts of the country and life returns yet again to normal, Americans are beginning to consider potentially taking a trip, some for the first time in 2 years. But if you are planning on traveling by plane, train, or bus in the next 15 days, you will not be able to ditch the mask just yet. The Biden administration says it is extending the nationwide mask mandate for airplanes and public transit until May 3rd so that it can study the impact of the new Omicron subvariant BA2. Public health leaders are also monitoring a slight uptick in cases in recent weeks, with daily confirmed cases nationwide rising from about 25,000 per day to more than 30,000. Dr. Monica Gandhi is a professor of medicine at the University of California, San Francisco, and an expert in infectious diseases. And she has helped us really for years now navigate the latest during the pandemic. Dr. Gandhi, always good to talk to you. And you always tell us focus on the hospitalizations. So give us a glimpse of where things stand with hospitalizations right now.
So this is the thing. We are actually in one of the best places in the pandemic that we've ever been. So it's hard to tell sometimes from the news and from extension of the federal mask mandate. But in terms of hospitalizations, we're at our lowest point since spring of 2020, since we started to record them. And the rate of ICU admissions and deaths are falling even faster, falling by 28% a week. So we are really in a great place for severe disease, which is likely because we have so much immunity in our population.
So does it surprise you? What do you make of the fact that the TSA extending the mask guidelines in Philadelphia is going back to the mask mandate indoors the day after Easter?
I think that these should not be extended and Philadelphia should not go back. And what do I mean by this? Well, the CDC put out metrics for what would enable us to have to go back to masks on February 24th. And they called it a community level. It was based on what we just talked about, hospitalizations. And almost the entire country is what they call the green zone. Literally less than 1% of counties are not in the green or the yellow zone. We want to be consistent with our recommendations, because what I'm worried about is that this decreases trust in public health, to focus on cases, to not go by the CDC guidance. I know the CDC is one who extended it, but it doesn't make sense because everyone else is kind of running around, being together inside, maskless, there's people. And so it just doesn't make sense that we're doing it on planes. We really want our trust in public health to increase.
Right. I've said for months, you're hanging out with people outside of a building or a restaurant without masks. And as soon as you walk in, you put them on and then you get to your table and then you take them off. It is hard to follow.
It's the common sense.
To follow the
common
guidelines.
Sense, it's not passing the common sense test.
Right.
That's the issue.
The smell test. I want to talk to you about the booster debate. That is continuing. And as we try to inch towards an endemic and not a pandemic, there are a couple of new studies. I know you follow them closely. One, benefits of a second dose for people over 60. Also a fourth dose being studied out of Israel. What should we be watching for?
So I will say that study from Israel, there were two. One looked at the benefit over 60, like you said, and the headline is it decreases mortality. But if you actually look at the paper, there's very little benefit to a fourth shot. And in fact, what Europe did is say, fourth shot, 80 and older, but we don't see enough evidence for anyone younger than 80 at this point. No harm, but there's really not good evidence for younger people than 80 to get it by the European data, even by that Israeli paper that's getting so much attention, and also by another Israeli study in the New England Journal that showed that those between 50 and 65 who are healthcare workers, no benefit of getting that fourth shot because they gave it up to all healthcare workers. So we need to work on preventing severe disease, and that's what Europe is doing. And I think we don't need a fourth shot right now.
And before I let you go, I want to talk about children under 5 years old, our toddlers, our babies. For parents of kids in that age group, it is still very concerning because they are unprotected. How close are we? How long before that changes? Where do the clinical trials stand?
So it should just take the FDA a minute to approve this, because what Moderna put out was data of 25 microgram dose from 6 months to 6 years old, given twice, 4 weeks apart. And though it wasn't that effective against mild disease, there were no hospitalizations, no severe disease. It's ready. Moderna wants to give it. And I think that FDA should approve the Moderna dose. Pfizer is going to take a little while.
Why don't you think they're doing that?
I think it's because everyone's sort of taking their time now because things are getting so much better. But you're absolutely right that right now for parents of younger children, they want that vaccine. So they need to hurry.
Right. I mean, they've been waiting. They're taking extra precautions until it happens. Yeah. The time is now. Yes. Dr. Monica Gandhi, as always, glad to have you on. We are still in a pandemic, although it is nice to see the numbers are reflecting some positive news.
Yes, thank you.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.